Hi, I'm Dr. Nastrovich, and in this short video I'm going to explain what a leaky crown margin is and why oftentimes we will recommend that a crown be changed that apparently would be good otherwise, but it's due to the findings that we come up with at your clinical exam. A crown margin is the area of the crown where the crown stops and the tooth starts. And this area is critical to maintain integrity for the crown to be serviceable and not leak and cause recurrent decay underneath. This topic comes up daily in the office, and I've clinically photographed a case which I'm going to show you on the computer so that you can better visualize what we're talking about if this topic comes up. So if you'll zero in on the computer screen, you can see that in this particular case I have cut the front half of this crown off, a crown that we were changing anyway because of crown margins and other issues, but the crown margin is right here on this edge where the crown stops and the tooth starts. And this crown's been on for many years, been very serviceable for many years. And if you look over here, it looks like there's no apparent gap or junction between these two, and I could run an instrument called an Explorer along here and it would seem good. But you come along to this area and you can see a little dark band right here, and if I blow that up, then this dark band looks a little more significant, and in fact it is, because when I come forward you can see where the crown now is off, where this dark band has expanded up underneath here, and this is recurrent decay underneath this crown and is starting to invade inward. Contrasted, you can see on the front side of this area where the cement, which is this white material up here, has disintegrated and left a stain, but the tooth structure underneath appears to be totally intact. How would you tell the difference between this area and this process going on with this crown in place? Be very difficult, if not impossible. But once I see this area and I can get an instrument tucked in here, we know on an old crown that we're going to see problems with this cement like this. Now, taking the view on the other side of this tooth, this is on the inside, we were just looking on the outside, you can see that this cement has failed all the way along underneath this crown. So trying to do a little repair on the other side, if we go back here, trying to do a little repair here to fix this would not have any benefit to doing this. In fact, it would just allow this to continue. If you look up here, you can see that this cement, this white material, still looks good up on top, but it was getting worse down here. Now if we take a look at the inside of the crown itself, you can see that again the cement was nice and white, pristine, just like when it was new up here, but around all the edges on this crown you can see where the cement was leaking. There was marginal leakage here and deterioration of the cement, allowing bacteria to get up underneath the crown and cause that recurrent decay. In a little different view again, taken from the side, you can see again this process of where the cement has actually disintegrated, and this is the pristine cement line, and you can see where this leakage has actually come up underneath to this point right here. Now if we go back, just as a review, you can see where this margin looked pretty good, this margin didn't, this margin was recurrent decay, this margin had leakage, but there was leakage going all the way around this crown. So was it a good idea to change this crown and to get this off of there? Absolutely. And that's one of the reasons we would recommend, when we can get an instrument underneath a crown like this, that we change it before this invades into the tooth and causes greater problems.